Do you know that not every fever is dangerous, but some fevers are warnings? And the scary part is this: sepsis can begin like an ordinary fever, but within hours, it can become life-threatening. Today, we are talking about sepsis, a medical emergency that many people still misunderstand, ignore, or detect too late. Hello, everyone, and welcome to the HealthWise Show. My name is Uche Namadi, as always, and I am your host. I will not be doing this alone. I have here my amazing co-hosts, Dr. Lani Yowe, coming from the medical angle, and Patsy, a lawyer, who is going to give us straight talks from the perspective of everyday Nigerian. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. Shortly, we'll hear a true story. Now, this story is especially important for anyone who has ever said, let's just observe it. It's just fever now. It's fever. It's teething. It's small malaria. Let's just observe. So settle it, because this conversation can actually save a life. Over to you, Patsy.
Okay, so we're reading a true life story,
Yeah.
something that really happened. And it says it's still like what many parents will consider just a fever. My 1-year-old daughter suddenly began running a high temperature. At first, we tried to manage it at home, the usual remedies, hoping it will pass, but it didn't. Instead, her discomfort worsened. She cried uncontrollably, and as a mother, I could tell this was different. But how do you know when a fever is no longer just a fever? At what point does waiting become dangerous? We decided to take her to the hospital where she was born, a place we had trusted for years. Unfortunately, due to an issue with our HMO, we experienced delays in getting her attended to. While that was happening, her condition wasn't waiting. And that is the thing about certain illnesses. They don't give you time to figure things out. Eventually, we were directed to run some tests at a diagnostic lab nearby. The results confirmed something that we hadn't even considered at the time: sepsis. How does a simple fever progress into something life-threatening? What signs do parents often miss in those early hours? How quickly can sepsis develop in a child? We were immediately referred to a children's hospital where the treatment began. It was urgent, structured, and intense.
Wow.
Though we couldn't stay admitted due to environmental concerns, we committed to visiting the hospital twice daily for 7 days to complete her treatment. Looking back, I keep thinking, what if we had waited a little longer? What if we had continued treating it as normal fever? Would we have recognized the warning signs on time? Sepsis moves fast, in children especially. It doesn't always announce itself loudly. It can start subtly, like a fever, irritability, or unusual crying. It's true that not every fever is sepsis, but every persistent, unusual fever deserves attention. Today, my daughter is well, but the experience left us with more than relief. It left us with questions every parent should consider, like, what are the early warning signs of sepsis in children? When should a caregiver stop home treatment and seek urgent care? How can parents advocate for faster diagnosis when something feels wrong? And most importantly, how do we stay one step ahead of conditions that don't give second chances?
Wow. This is very emotional and deep. Just fever.
Just fever.
There's no just fever.
As in, because I'm in fact, if it's on Twitter, they will say retweet. Though I'm retweeting her question: how does a simple fever progress into something life-threatening? How?
I think I would just open this with this statement. There are 1,000,001 causes of fever, and malaria is just one of them. Sorry, I'm mentioning malaria, but then I need to mention it because
We've
more
abused
often than
it.
not, it's whenever someone has fever, what everybody thinks is malaria. No, First, to answer your question very well, we actually need to consider what sepsis is. You understand? Um, Sepsis is like a like generalized infection. Now, what that means is when infection or a disease-causing organism enters into the body, a disease-causing organism, either a bacteria or fungi or parasite or virus, when it enters into the body, there's a site that it can enter into the body through the skin, through any of the openings in the body, but then it usually favors a particular site.
Yeah.
Like if you have let's say upper respiratory tract infection, you know that whatever disease causing organism you have is in your upper respiratory tract, your nose, your throat, your ears, and things like that. Then of course if you have what we call gastroenteritis that gives you diarrhea, nausea, vomiting, you know that the infectious disease causing organism is in your digestive system, like your stomach, intestines, and all. Then you would have like that. You can have infection in the leg, blah blah blah. You can have infection in the bone, anywhere in the body. You see them localized there. Now, sepsis occurs when that infection spreads into the blood, and of course, you know that once anything gets into the blood, it can basically get anywhere in the body. So that basically is what sepsis really looks like a systemic kind of infection. The infection moves from the site of the local invasion, where the infectious organism, invades locally, moves from that site into the blood. And of course, the blood acts as the courier to other parts, of the body. So it's like systemic infection. So that's basically what sepsis is all about.
Wow.
Now, when there is a disease-causing organism in the body reacts to it. It's like action and reaction thing. Someone slaps you, you slap back. So when a disease-causing organism enters in the body sees it as an insult, and then it tries to fight back. And what fights back in the body? The white blood cells.
Sure.
They mount up like a resistance against it. And in the process of fighting back, there are certain substances that are released into the bloodstream that actually causes fever. So that brings me back to sepsis. So when you have like a widespread infection, so to say, what you are going to get is a continuous high-grade fever. Because one of the things that is required to actually have that is there are several factors that can actually make someone to progress into sepsis. Number one is the factor that has to do with the disease-causing organism itself. Now, if the disease-causing organism continues to multiply unchecked, then it could actually become sepsis. You understand? Because now they move from that site to other parts of the body. And what contains those disease-causing organisms locally, the white blood cells, and then of course, in antibiotics and what have you. So in sepsis, what you are getting is continuous high-grade fever. So
wow.
I liked, what I read, what I just had now from the story you read. When the fever becomes persistent, normally the fever pattern in malaria is like an intermittent fever, so to say. It's usually worse at certain times of the day.
Yes.
You understand? It's not always there continuously. So at certain times of the day, the fever gets, very high. The child begins to shake, with chills and rigors and all that. And usually when you administer paracetamol or you sponge the child, the child, might actually get better. The fever might break.
Yeah.
But with sepsis, the fever is continuous and is high grade. So, and sometimes you find out that it's not even amenable to your paracetamol you're administering and all that. And that's why you would say that. And I love that once a child has a persistent, continuous high grade fever, straight up to the hospital, because you may be dealing with something that is more sinister than. And of course, from what I just described now, sepsis could cause convulsions, could cause renal shutdown, renal failure, could cause even bleeding from all the orifices in the body, could cause heart attacks.
Wow, I
it's
didn't see that
everywhere.
coming.
So it's a whole lot, of things
Wow.
that you would see with it. So it's like a complication of an untreated, unchecked infection. I would call sepsis like a complication of an untreated, unchecked infection. Now, you can actually get sepsis like from a direct inoculation. I will explain what I mean by that. When you have a direct inoculation of disease-causing organisms directly into the bloodstream. Maybe, for example, someone is being transfused with an infected blood. That is going straight into the bloodstream, and then you find out that the person within few hours is already having high-grade continuous fever. The kidneys will shut down and all that. So you can actually have like a direct. So once you have infectious agents, directly inoculated into the bloodstream, you can actually have it being spread to other parts of the body. So basically, that's what sepsis is all about. And usually, what you would see is continuous high-grade fever, and that sometimes is not even amenable to all your home remedies and even paracetamol.
That's what the was it a mom or a father that said this?
I think it's
the mom. Yeah, I think that's what she missed. The fact that it was persistently, and probably she said she tried home remedies and none of them worked. So it's more like you're giving paracetamol, but the paracetamol is not doing what it's supposed to do. You should immediately jump. Wow. So, like she asked, how quickly can it develop in children? Is it like a 24-hour thing, or?
It can develop quite fast in children.
Wow.
Because children are more susceptible to infection because immunity is not well developed. So you don't want to actually take chances with children. Once you actually notice a fever pattern that is high grade in 24 hours, and then you're doing your normal home remedies, you expose the child, you bathe the child, you tepid spawn the child. Most mothers have either ibuprofen or paracetamol you're giving, and then the fever is not even crashing or it's not going down. I mean, within 24 hours, it's not going down. You should just visit the hospital as much as you can.
This is quite relatable because I just experienced something like that. So the paracetamol, the sponging, nothing. And then just getting to the hospital, we had to stay the whole day.
Okay.
Yeah. Then, like the whole, not overnight though, but we spent the entire daylight. Then we went back. We came back and continued. It took shots and infusions and a lot to get that temperature to come down.
Good.
So I think a lot of it comes back to what we talked about when I think we had a podcast discussion on this same malaria thing where people like to try their luck first. And you cannot be trying luck with a child.
Trying your luck with children.
But another thing, I because when I was reading this story, one thing that came to my mind was, parents sometimes get turned back in the hospital for being overly vigilant. Do you understand? Like, hey, you are just coming to the I've experienced this firsthand where they would tell a mother like, your own is too much. Do you understand? Every small thing you bring the child to the hospital. Go stay at home with him first. Children, they fall sick easily. Just wait small. Do you get? And if you've gone to the hospital 2-3 times and they've told you are just being dramatic, every small thing you carry your child to the hospital, you might want to stay at home and wait it out.
No, I don't really think that's proper practice. And I think I said it in one of our earlier shows. A mother knows her child.
Yeah.
And I always say it to patients that you know your body more than anyone. Earlier today, it's just a little bit of digression. I was reading online where a woman for years, she kept going to the gynecologist that I feel like a fullness, around my private area. There's a fullness around my private area that I cannot explain. Maybe the lower part of her abdomen. She feels something moving in the lower part of her abdomen, very close to the private area. And then she would go to the gynecologist. The gynecologist, it was in the US, would examine her, do vaginal examinations and stuff. And then would not say anything vaginal examination. But she knew something was wrong. And then eventually she went to meet somebody who was going to do something extra. And then, of course, the person would examine, feel, your tummy is not whatever, you're not having any symptoms, you're just imagining things. So she went to somebody who were probably going to do something more. And then They ordered abdominal ultrasound scan. The examination again was still like the same. Ordered abdominal ultrasound scan. I think now the person now also decided to do like a cervical examination or something. And then the gynecologist felt some form of swelling around that cervical area. So ordered abdominal pelvic scan. And lo and behold, there was an orange-sized fibroid around the neck of the womb. And this was in the US. Now, the reason I'm saying this is the proper practice is once a patient keeps coming, and it's not even a child. A mother comes in and tells you that my child is hot. My child has not slept because children cannot talk. So usually when they have high-grade fever, they become fretful, they become irritable, they refuse feeds. If they are still sucking, they refuse to suck. And mothers, one of the ways mothers would actually pick that up fast is when your child is suckling at your breast, the temperature, even sometimes the child is not feeling that it's not feeling as if the child is very hot, but then the temperature around the nipple feels a bit different. Some mothers mothers say that I think this child is having, you understand? So when a mother comes and then is telling you that this child could not sleep all night, it was crying all night, and the temperature keeps going up, and then I think, in fact, it's not a doctor, whoever you are, should at least examine the child and measure the temperature. Because you know that in children under 5, high-grade fever can make them convulse. And then convulsion can be complicated by cerebral palsies and stuff like that. And you don't want that to happen. So that particular period is a very delicate period. And so with children, in fact, one of the things I give credit for pediatricians, to pediatricians, for is the fact that they're able to deal with children despite the fact that they cannot talk. One of the reasons that made me not to do pediatrics, is the fact that children cannot actually express themselves, and then
you can't speak their language.
I don't like to see them cry. So you just see the child crying, irritable. So it takes a whole lot of observatory skills to be able to say, okay, it's this, it's that. So for me, it's not proper practice. When a mother keeps coming, especially has to do with fever, I don't think any doctor should dismiss any child with fever under no circumstance. Wow. Because we know that fever in children is dangerous, especially when it becomes persistent, recurrent, and all that. So for me, I don't really think any doctor should dismiss, because when you look at stories from all around the globe, you find out that sometimes patients are right. Patients are right.
But you know that according to the lady, she said, what if we had waited a little longer? What if we had continued treating it like normal fever? They would have lost that child.
Yeah, probably.
They would have. Maybe. They would have lost. I don't even want to think. So, but again, what are those early signs, apart from the persistent fever that is not going down? And so is there any other thing in particular that is tied to sepsis? Okay. That when you see, you would not even bother wasting your time, you just run?
Okay, there are no specifics like that, but these are some of the signs that mothers should, or parents, caregivers should be on the lookout for. Refusal of feeds. Irritability. Fretful children. Child that used to play and is not playing anymore. This could be the early signs that something is wrong with the child. Then, of course, sepsis will always have a focus. So that probably have been a history of runny nose, blocked nose, mouth breathing, or you find out that a foul odor is coming from the child's airway. You understand? You would see all that. Or anytime you touch the child's ears, the child cries. So a mother mothers are heroes, super skilled persons, because their observatory skills have to be like top notch, because you need to deal with children who cannot really express themselves. So sepsis will always have a focus, a primary site of infection. So, and usually for children, you find out that sometimes you have upper respiratory tract infections preceding sepsis. So the child might have had a runny nose, might have had blocked nostrils, noisy breathing, pain when you touch the ears.
Wow.
And then you might also have the child having cough. The child might have cough, especially if it's lower respiratory tract infection. Child might have cough, cough. So that means, that cough could actually be, the focus is in the chest. Cough. And, sometimes in very young children, you know, the way it happens is the mother is breastfeeding the child, and then after breastfeeding, the child can start coughing, and the force of the cough might even make them to actually to throw up and things like that.
Yeah.
But then the child is breastfeeding, and then the child stops, and it seems as if the child has some form of hair hunger. You understand? Because of tiredness. So these are some of the signs of tiredness in children. The child suckles at the breast. You know that it's just like you know, any other just like children. When children see food, they're always very excited and happy. See children when they are put to breast, you see the way they're agile and all that. So the earliest time may be that you put your child to breast, and then the child is not as agile as the child used to be, or the child sucks for a few seconds and drops the breast, and then looks as if the child is trying to gasp or bring in air and all that. So those are some of the things that mothers should be on the lookout for. They could also be preceded by diarrhea, because diarrhea is also one of the causes. That could be a focus. Acute watery diarrhea, especially when they begin to grow teeth and are putting all sorts into their mouth, or they begin to attend creches, and then things like
get the first baptism of fire.
So you could actually be loose bowel motions, child is vomiting, and things like that. So these are the things you look at. And then also the focus can also be from the skin.
How so?
So the child has a lot of all these funny blisters on the skin, all these rashes, skin lesions. And mothers sometimes, as mothers would almost always do, they will put all sorts of powders on it and
calamine lotion,
so
dusting powder.
For some children, after a while, you find out that they have these rashes that wouldn't go away, and then they start running fever. Because some of these rashes, quite a number of them are viral in origin, and they're always self-limiting. Sometimes some of them actually have, and one thing about children is, even when a child has a viral infection, there could be a superposed bacterial infection on top of it.
Wow.
So you don't just say, okay, this child has, and then you just things like that.
7 days.
So you can actually have
7 days.
the skin. When you have the skin, you can have blisters forming, bullous stuff, and then you see all that. And then child start having fever. So one thing about sepsis is there is almost always a focus for it. So for children, the common places, point of entry is the upper respiratory tract, the digestive system, the skin, all those things. So you would have this history of the child had features of catarrh, cough, and all that, maybe a week prior to that time, or the child had a diarrhea 1 or 2 weeks before that time. So there will always be something, before that time. But some of these signs that I've actually, put out here, there are some of the things that mothers should actually be on the lookout for. And then, of course, the fever is always present. The fever is always present. But mothers, when you begin to notice some of these signs in your children, you should actually have them checked out. You shouldn't just feel like, okay, blah, Child that usually when you bring out the breast, is always very excited. Once you even tear the nipple off, suddenly doesn't even feel very excited about it anymore, or suckles a little bit. And then seems like the child is playing with the nipple, and you're trying to put the nipple back in the mouth. The child is, taking the mouth away. So these are some of the things that, they may be very subtle, but then they may be very significant in a child.
So, I want to drag HMOs a bit. You mentioned it. Because my next question is going to be, how can parents advocate for faster diagnosis when something feels wrong? So now you've tried the home remedy and it's not working, and you should go to the hospital, and then you rush to the hospital, and then you have to wait for HMO. I don't even want, as in sometimes they can be super annoying. So they don't also help the matters. How will I put it? They don't help the urgency. So I don't know. Patty, have you experienced any HMO?
Severally now.
I've laid down.
I'm a doctor.
I have laid
experienced
down
it.
in the what's the word? Reception.
HMO,
Because I was literally almost passing out. They ended up admitting me that night, but it took so long for my HMO to approve that I could not even stand up again to even go and complain. I was lying down on they had their metal chair in the hospital reception because of HMO delay. If it was something that was worse than that, and they're like, well, we are waiting for your HMO to get back to us. how long does it take you to approve or disapprove the plan? You know?
I don't even know what to say because
I
everybody has experience.
Yeah.
Are you people operating from the same SOP?
I think I actually have some theories in my head.
Okay.
You know, I feel that I've not worked in that setting before, but then
You don't have
do they have? I believe doctors should actually they should have doctors working in the HMO. When anyone is calling from the clinic to seek approval for either a procedure or some form of medical intervention, it should pass through the doctors, and the doctors should always be a doctor should always be on ground like 24/7. So sometimes I feel that maybe the people that give these approvals are people that just see it as normal job, normal
work.
duty.
There is no sense of
They don't even
urgency.
understand
That sense of urgency
they don't even
going on.
understand the importance, the implication
They
of
are
what
not even
someone is
health
saying.
inclined.
So because if you are
medical
so because
inclined.
if they are telling you that okay, someone has difficulty in breathing, or a child has persistent high grade fever, with difficulty in breathing, and then maybe they need to do a chest X-ray or CT, whatever of the chest, or the child has seen a consultant, and the consultant feels, or the child has seen a pediatrician, and the pediatrician says, okay, we need to do a CT, or we need to do some specialized test, or something, and then they feel that because if a doctor is there, a doctor, I'm sure, knows what to do. Even if a doctor is not sure, a doctor calls immediately because he knows the implication of that, because this is a child. So I feel that, my own thoughts, I believe that most of the people that they're the client-facing people, a lot of them are not medically inclined.
No.
And they don't know the importance of these things to health. Like yesterday, I still did a procedure for a patient, and it was all, before we could even get approval for the procedure, it took almost 2 months.
Wow.
I mean, somebody that was having recurrent back pains with dizziness, weakness, anemia, and recurrent back pain. And then we needed to rule out like a form of blood cancer. And then we needed to do a bone marrow.
2 whole months.
Yeah. So the patient had not gone to work for 6 months because of this.
No.
Okay,
And
so
then
now
they
where
did not
did
give
the money
approval
for the
until about 2 months. So that was why when I took the sample yesterday, I had to bring it, I had to do some things personally. I had to bring it up to the lab myself to check myself, because I can't be waiting. Only God knows how many months it will take them again to actually give approval for the tests. And
Why?
this person has had no diagnosis for 6 months,
And
because
you know
it takes a lot of time to actually get approval from the procedures that specialists recommend for the client.
And then you're asking yourself, why do I have a HMO? Because some people, in my head, sometimes you just feel like, and I've had this feeling, like, in fact, it has happened to me where HMO wasted my time so much that I had to just go and buy drugs. Do you understand? I had already, this was telemedicine, do you understand? But I was waiting for drugs. I'm almost at the point of, I had to now go. So if I have to pay out of pocket again, why do I have the HMO? I could have just gone to do it out of pocket.
So
it has defeated the purpose of it now.
my opinion, though, so let's not rule out that there are a few good HMOs.
Of course.
There are. Those that would even give you access on the phone to chat and ask.
Yeah,
the people I'm currently using, they deliver my drugs at home. I do not have issues with them.
Are we using the same person?
I don't know. Don't ask me. Don't ask me. But my own concern is, even if you are not medically inclined, I am of the opinion that everything health should be urgent.
Jenna.
Everything health. If I'm coming to do wellness check, it should be urgent. Do not keep me on the line. Because if you understand that somebody woke up and felt something and decided to walk in, the people will call self-referred. They walk in, a walk-in client, and they want to do some tests. And then okay, fine, you do your due process, you give out numbers and tallies, they are waiting, and then it's taking forever for you to attend to them. That's very bad. And this one you're saying, bone marrow, and then the person waited for 6 months. No, now, what are we now doing?
For 2 months.
For 2 months, sorry. For 2 months before the person got approval. I think, so again, how would you now want this guest that told her story to actually push for a faster what's the word? Consultation.
Yeah.
If you cannot even approve on time.
And of course,
What if our HMO is not the type that she can actually call and say, I'm in the hospital, they are delaying me, so that you can fast track it?
for me, I think what you mentioned now would actually work, because I think I have an idea of the HMO you're talking about.
Calling to
Because
fast track?
You can always chat them up. Yeah, and they will chat
I
you
don't
up.
reach your office.
Yeah,
My
no. So if all HMOs can actually adopt that kind of mechanism where at least be responsive.
Yes.
Be responsive.
someone
Even in
spend the
medicine,
whole
we
day?
triage. Yeah, there are people who actually abuse, the HMO. But there are people like, for me, I cannot remember the last time I used my HMO. Because the last time I went to the hospital, I had malaria. I went, of course, I'm a doctor. I could have done the usual over-the-counter stuff. I said, okay, let me go do test them. And then I went there and I waited in line, did all I needed to do. And at the end of the day, I got a medication that I was not satisfied with. I just left it at the table in the hospital. And I went to buy.
After your time, precious
Because,
time.
I already have my test done. So I just left. And that was the last time. It's almost 2 years now that I used my HMO.
Sorry.
No, see, basically it's annoying, So just try as much as possible to be responsive. There are people who abuse it, but then you would have it in your records. Someone has not even used you in like a year, in months, and then person is coming up with this, and then you are delaying again. It doesn't make sense.
You are delaying.
It doesn't make sense. So at least be responsive. Have a platform where people can actually get to chat you, and then you respond immediately. And then you do whatever triage you want to do.
So what if that lady in waiting, something bad happened to that child? That HMO will be sued.
Of course.
Will be sued. And then the last question she asked, how do we stay one step ahead of conditions that don't give second chances? This question scared me because sepsis don't play. Doesn't give second chance. Septic shock. Abi?
I've never really liked the idea of sepsis.
What, apart from, I think you've mentioned a few already.
Information.
Yeah.
The right kind of information and taking proactive steps. One thing I don't do is I don't like to take chances with children. They cannot talk. So, as a parent or a caregiver, do not assume anything about children. You have to it's a full-time job. As I would state again, mothers, caregivers are heroes because, dealing with children, that's not easy. So you need to get the right kind of information, and then you need to be observant. You need to observe your child or your ward, and then you need to be able to take proactive steps. It's not just saying, oh, okay, fine, this is what I noticed about my child. This has been the trend. I think the reason why a whole lot of times people tend to also delay is sometimes they feel they will not be attended to on time in the hospital. Sometimes it's also the poverty thing. They'll be like, I don't want to get admitted. If I take this child to the hospital now, I will get admitted. I will pay. Who will stay with the child? So there's a whole lot of things, about it. But then, ignorance is costly. Yeah,
it's more expensive actually.
Yes, it is. So for me, it's better you take the child to the hospital, and I don't really think there's any hospital that would actually turn you back. So now you take your child to the hospital, and at least once they actually see the condition of the child, no one will. I don't really think any hospital will see a dying child and they will tell you to get out of our facilities or our premises or something. I always say it's better to actually overdo with children.
I think I was going to say add that I do believe that if you were a parent, it's better to err on the side of being dramatic than to.
You don't have anything to lose.
Do you understand?
Yeah.
Like honestly, I'm very much with the being known for that, being the dramatic parent in the hospital, even in school. They should know you. They should know your name. Do you understand? When they say so and so child, they will know it's you. I'm very big on. I like parents.
I'm that parent.
I'm not saying that. Yeah, I'm not saying that you should be a troublemaker, but learn to advocate for your child. You came, your child's having persistent fever. It's just a fever. Come back in 24 hours. No, you will test my child now. And that's what you are going to do. Do you understand? Like, you're going to test this child now. And in Nigeria here, sometimes they will say...
that's borderline violence.
It's not borderline violence, so,
You
but
must
honestly,
test the child
okay, no.
now.
But what I'm saying is, like you said, because I said I've been there where they will tell you, you always bother. Sometimes it's children. Do you understand? Sometimes you have to push for it. Do you understand? Push for it. Like, no, please. Tell them, even if it's not anything, okay, yes, you are dramatic, yes, I am. Oh yeah, please help me just to allay my fears. Okay, see the child. Do you understand? Just touch their body so that I will know that you've touched their body. That kind of thing. Do you get? If you have to be that person that makes that, some people and wind up being too shy. Do you get, or too reserved? So there are actually people whose maybe their personalities or something. When they tell them nothing's okay, you know in your heart something's doing the child, and you're just like, okay. Doctor said sometimes. Do you understand? You have to repeatedly go back again, try again, make sure, explain as best as you can. The way I say, sometimes imagine as a mother, you might feel like you're being dramatic if you are saying something like, "Oh, this child is fine," but when the child is sucking, I can feel a difference. It seems like it's all in your head, but like, say everything. Do you understand? So it's err on the side of being dramatic than calm.
Why do you think an average individual does not know a lot about sepsis, despite how deadly we have seen it is?
Because you are not in the medical field, and a lot of us don't know things that have not happened to us or somebody around us, I would say. So the only reason why I know about sepsis is from stories. Okay, first of all, I'm just generally, like, I like to read medical stories, but also I know people that have had issues with adults. I've never heard of sepsis. Like, I've never seen a case of sepsis in a child. But apart from that, there's really no other reason for me to have found out. Do you get? You generally, how many medical issues, should I say, problems are there in the world? You can't know about all of them.
No, you can't.
Right? So it's usually things that come within our doorstep that make you know that, oh, this even exists. You know, even when I saw the topic we were handling today, I told people that sepsis is not something, because of the kind of stories I've heard, how fast it can progress, how much it can affect things. Whenever I hear sepsis, I'm just like, like, just no. Do you understand?
Yeah.
And yet it's not even something that, so far so good, I've known that this is how you can prevent it. Because every single case of sepsis I've heard, they were not even trying to have sepsis. It just kind of like fell upon them. Do you understand? So I don't even know if it's something that you can prevent necessarily. So
it's like the complication of an untreated, infection.
Wow.
I mean, I would just put it that way. But she said something. You cannot know everything in the medical world, but at least you can be observant.
Telling you.
I mean, the best kind of doctor for yourself, so you can be observant. And I think a lot of people are not usually aware of themselves.
That's
the problem. So people that are not even aware of themselves, how would they even know when a child is?
Some people bathe every day and don't even look at their body.
It's I find it very disconcerting that people are just like that, where it's your identity, it's what you own. It's the only thing that you own, really.
Actually.
Because, I mean, when you die, you carry nothing. The only thing you carry to the grave is your body that you came with. So how would people not just be so ignorant of their own bodies, what is happening in their own bodies? So people who are not even aware of themselves, how will they be, aware of what is happening? There are lots of people like that. They don't even notice. Sometimes it's even strangers that would say, this child has his yellow, mama, something. Or maybe they go to church. Don't you notice that this your child is some? I don't think it's. So for me, even if you don't know anything, at least be observant.
Okay, so one myth I've heard, people likening sepsis to spiritual attacks.
Okay, well, everything.
We
liken everything to spiritual attacks in this part of the world. Everything that is not good. Everything that is not good. Everything that is not good is spiritual.
Okay. And
a whole lot of times, I'm sorry to say, even that same Bible says, my people perish because they lack knowledge. Is that what the Bible says? My people. That part of the Bible did not say demons. Did not say evil people. Did not say witches and wizards. My people perish because they lack knowledge. So for me, a whole lot of it is just lack of knowledge.
Yeah.
Please, let's just be sincere.
Yeah.
It's not any arrow from your father's house or
From your father's
whatever.
house. Okay. Thank you very much, Dr. Way. Sadly, we have come to the end of our HealthWise show. I'd like to say thank you to our guest who sent in her story, and then thank you to my co-hosts for doing justice to our topic. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. My name is Uche Namadi. This is the HealthWise Show, and I'm signing off.